ana tamanui te rā e ki runga i a whaira wai Heke mai ko te marangai Waipuketia Ngā tiriti o te motu E te tangata e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He runui, he ruroa Naru wai moko te runei ha Kia hakarongo te ao katoa Wa he katoa te pā Tirohia ngā whenua Tirohia ngā moana Tirohia ngā tangata Wariro atu rā e ki Ka whiti ana tamaru i te rā e ki Ki runga i a whaira wai Heke mai ko te marangai Waipuketia Ngā tiriti o te motu E te tangata wā e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He au nui, he au roa Nā tangaroa te au nei ha Kia are te ao katoa Kua he katoa te wā Me hoki haka murira Ki ngā kupu o re hera Toi tū te kupu me te mana Toi tū te whenua Daram 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 bum bum
Right, and that was just the intro. We've got one more video coming up. One of the things I liked about that first video, by the way, carry on, get the next one going, is that we deliberately didn't show any needles. And we discovered over time that there's quite a lot of needle phobia. So from now on, all of our all of our video stuff will have people getting the vaccinations, but not showing the needles. There's a trick. Okay, one more video. We're going to hit play. Kia ora tātou. Thank you for joining our webinar on Omicron tonight.
And we just wanted people to be able to ask questions and have answer their worries and then go away and think.
You know, for better or worse, we are still in a really good position compared to some other countries who've experienced these big surges.
We've got to protect our workforce, probably like all Māori providers. The issue I have is trying to stop our kaimahi from trying to work 24/7.
So COVID's not only an infectious disease, it is a mental illness pandemic as well.
It's a very normal human neurological reaction to become hypervigilant, or in other words, on edge, when faced with uncertainty and change.
Actually, it's less about infectious control and it's more about saving Māori lives.
And kia kaha tātou, we can do it because we you know, manaki's in our bones and we can look after each other, and I think that's where it's at.
Tēnā tātou. Tēnā tātou ko tai mai, ko rahiri mai, i tēnei hui a tupa. I te ahi pōnei, e tika ana, kia tuku i te reo rongo mai whiti ki te wāhingaro, kia te wai tōna marino, ki rungi a tātou, e āta wānanga, tātou, e āta kimi, i te māramatanga ke puta, he whakaarunui. Piki ake tā whaki i te ara kuitu, whakatawira ai te aro rangi, te aro tūkai te uru. Ka kakea te ara whaiti, ka kakea te ara whārahi. Ko te arei whakatawira ai tō tūpuna, ko te aununui, ko te auroroa, ko te awhititara. Tēnā kā eke. Kei tō ihi, kei tō mana, kei ngā mana o runga, kei o ariki, kei o te pauru, kei o pūkenga, kei o wānanga, kei o taura, kei o tawira. Turuturu whakamau wā kia tīna, tīna, haumie, hui e, tāi ki e. Ka tuku ki a koe rāuri.
Kia ora rā, ka mihi kia koe Jason i whakatūwhera tā tātou hui te pō nei. Tātou e tau nei, tātou e whakarauika nei, tēnei rangi, tēnei pō, mō nā kōrero mō tēnei mate uru tā e rere haere nei, ki ngā wāhi katoa o Aotearoa ka mihi tēnā koutou, nau mai, haere mai. Well, look, there's heaps of people have joined, and I'm reflecting, you know, just over a week or so ago, we were here together, well, virtually together, and we were having a talk about Omicron and what it means. And one of the things that came out of it was maybe we should just bring the focus towards a particular topic. And so tonight we've brought it down to talking about whānau, talking about plans for managing through Omicron. And I'm really thrilled. I want to thank everybody who's joined us tonight, the panel who's here with us. We've got 3 wahine who are really going to help us understand some of the things to think about and plan for in terms of Omicron. We're going to start with Tina Ngata, ka huri kia koe te tairāwhiti matakawa, ka mihi, tēnā koe.
Tēnā koe e hoa o tira tēnā tātou, kua whakarauika mai i raro i tēnei kaupapa, te kaupapa o te uru tā kōwhiori, kei o tātou hapori, mai tēnei mokopuna hikurangi maunga a Waipu awa a Ngāti Porou iwi a ngā hapua te whānau tūwhaki ora te whānau hinerupe, te whānau karuwai anō hoki tēnā tātou. So, yeah, awesome. Thrilled to be back. So thrilled that this channel is up and running for our whānau. Thank you very much to Wirohia and as I say, everybody, Te Ropi Whakakaupapa Uruta, everybody who's been involved in getting this up and going. I guess for whānau plans, and I want to be clear from the outset that obviously everything I say is from our context of being a matakawa, and you know we live in a very isolated spot. It's 5 hours by ambulance transfer to the nearest hospital. We only have 1 or 2 ambulances, and we're finding out not as reliable as we'd hoped. But also we have you know, very limited health resources here. We don't have a GP, and very thankful again to National Hauora Coalition and Dr. Jansen for helping us out with that, but also we're just stretched in general with our health services. So we've had to be very preemptive, and sometimes it's taken the form of checkpoints, and other times it's taken the form of planning as well, and just trying to kohi as much as we can, get everything we can together in terms of resources and information, and using our spare time to wānanga and capitalizing on the strengths that we do have. And some of the strengths that we do have is that being a rurally isolated community, we have great kotahitanga. Everybody knows everybody else, and we have really strong relationships that we can capitalize upon. We have our manaakitanga on lock, and we do know what's going on with most of the households, which is something that we have in our back pocket. So we've tried to focus a lot on our strengths, and whānau planning really has been a huge part of the puzzle for us, because we also have quite a few our community health profile combined with our socio-economic situation, combined with our geology and our distance, combined even with the natural disasters that happen all around us, kind of create a perfect storm in a literal and metaphorical sense. We have a bit of a perfect storm for COVID for here in the remote isolated areas of Ngāti Porou. So yeah, whānau planning has been a big part of it, and I guess I could just show you a couple of the things that we've done around whānau planning and some of the key areas. I know a lot of people have done, there's a lot of different versions of whānau plans out now. we kind of have gone into, we've got a few kind of key areas that we focus on, and I did upload our whānau plan template onto the Te Rōpū Whakakaupapa Urutā for people to focus on. There's probably a couple of key things that for us we wanted to make very clear around whānau plans. One, whānau plans are really helpful for whānau to think about the things that you don't know what you don't know, right? So you don't know what to plan for unless somebody provokes you. So it does help whānau, it provokes whānau to think about a few different things that they might not have considered before. But also whānau plans are way more helpful if they actually come back to us so that we can utilize them to build information and to be prepared for each of our whānau if we need them to. So I know that there are some formats of whānau plans that just go out and they go to the whānau and they stay with whānau pai tēnā. For us, we wanted to make sure that we wanted to get that information back, because a big part of the puzzle was us being able to be prepared for those whānau, so that as soon as maybe somebody else in that whānau or somebody who we know is associated with that whānau catches COVID, we can kind of go be prepared a couple of steps ahead before that actual person or that household catches it themselves. So I'll do a little bit, I'll do a share screen just to show you a little bit of our whānau plans. One moment, if I bring that up to here. Where are we?
Just while Tina's bringing that up, I notice in the chat that Eduardo has loaded a place you can go and have a look at some of these whānau plans. And the question and answer function's open. Please start typing any questions. Back to you, Tina.
Yep, thank you. So yeah, I mean, we generally do these things by address and whatnot, but there are some key areas that we want to find out about, and we do have a printed version of this Google form as well. But we want to make sure that we have their permission to be the caregiver for each of the households, and you know, some of that early stuff around understanding what the vaccination status of the different members of the household is really helpful, and what their age groups are as well, and any underlying health conditions for obvious reasons. That's all really helpful information for us. The other things that we generally ask them about is whether or not they have regular activities that require support. So we knew when we did our checkpoints that a lot of people roamed because they had to feed their animals, or they had an auntie that they had visited every Tuesday for 25 years. She would freak out if you stopped for no particular reason or whatnot. So we wanted to find out from whānau, what are your regular activities that might cause you to want to leave the house that we can provide some support or get you to think about. Some of the other issues are around other, you know, what are some of your relationship dependencies as well? What are your isolation, you know, what, just anything that would challenge you to isolate at home. If you had also, you know, other whānau members that might have health conditions, we want to know about those and whether or not you might consider putting them somewhere else if somebody tested positive in your household. And that's actually one of our early first cases out the gate. We were really glad we got them to consider that, because we were able to separate them before it was transmitted onto a very, very vulnerable member of the household, and have that taken care of. So just getting people to think about, you know, different scenarios. Children is a big one. We definitely want to know around how do you want to manage your childcare arrangements. If you get sick and you have to be hospitalized, who can come and look after your children if they're negative and healthy? That's an easy one. Who can come and look after your children if they're not negative, if they're also very sick? And having some of those things up front really help us. And just some of the things around, you know, that might, complex situations that might confound, you know, your isolation or confound the care for the isolation as well. We want to know about those things just to see if we can try to organize some solutions early on in the piece. So things like addiction, mental health going on in the household's dependencies. There's probably quite a few whānau, I think, who they answer it one way, but they actually, once they test positive, they do want to go back and review. But we're finding the whānau plans are just saving so much time and are really, really helpful once they are testing positive, they're really, really helpful for us to be able to wrap that care around them. Information is a big one for whānau. So we have put together an information program as well, and that goes out with their whānau plan. So as soon as they test positive, even though they've got a copy of it anyway, we want to make sure they've got a copy, because sometimes you put it in a drawer, then you forget about it or it gets lost. So we print their whānau plan out, and it goes out with this information booklet. And that just has some tips for them around avoiding household transmission for people who are household contacts. So things, you know, sterilizing, keeping to your own stuff, not sharing towels, and even how to set up a room, you know, putting a door stop in to stop air from going between spaces, and having the fan facing outwards towards the window, and the benefits of wearing a mask inside the house. We are very aware that Omicron is much more infectious and more difficult to avoid household transmission, but we've managed it. So we still try to get people to do all of those little things, and bathroom solutions, put the seat down when you flush the toilet, and just giving people a little bit of advice around how to manage yourself in the household, clear information around what your kaimanaki can provide for you, and setting some, you know, your clear, like, what is your place where your kaimanaki can deliver things to, what days will they deliver to you on. You can text them anytime, but if they are going to come around, make sure your children are inside, make sure your animals are tied up, and just a few little agreements like that. And what we find is people have these little, you know, when everything's going a bit nuts and you've got lots of people calling you and you're just probably freaking out a bit, having something you can hold, like a physical, tangible thing you can hold and go, right, here's some tangible advice, something that they can look at, is really helpful for them. It'll take, as we know, 24 to 48 hours for just the storm to settle around, the mental and emotional and wider storm around them to settle down a bit. And then at usually about 11 o'clock at night, when it's nice and quiet, the kids are all in bed and everything's settled, you'll pick it up and have a bit of a look through it, and then that information becomes really helpful. So yeah, and also giving people advice around taking readings. If they do have an oximeter, then give them some advice around how to use it, because we are finding some whānau are not, you know, either wearing nail polish or, you know, taking their readings after going for a run around, you know, especially for kids and stuff like that, and giving them some good advice around what's okay and what's not okay, specific for our situation as well. Oh, and then I'll just say finally, tips around just manage it, because we are, you know, and we all know there's some frayed relationships that go on for isolating households as well. So just a few tips around how to manage your relationships so that you don't get hōhā with each other. But, you know, a few different things like creating a COVID rāhui each day. So an hour to an hour and a bit where you don't talk about COVID. That came from Kazi Boyd Broughton, and it's actually worked really well for our households. Taking some time out, so deciding amongst the adults in the house, right, who's going to be the one taking care of the kids, you know, for the next couple of hours, I need some time out, and they just, you know, have a rāhui space for each of the adults, and you'd circle that through. Reaching out to other whānau, having, like, choosing a close kazi that you'll be your buddy for them, and they'll be your buddy for you when you test positive, and reaching out to talk with them. And also, yeah, but if you know, getting your kaimanaki to even call in and watch an online movie with the kids via Zoom, or play some Zoom games while the parents have a breather, and some tips around looking after. We get a lot of queries from whānau who are worried about how to, you know, looking after COVID positive children and what kind of support there is. Oh, finally, the other big stressor for us, for our whānau, has been income. And we're seeing that it's a big concern in terms of whānau not wanting to report testing positive and worried about their work and income. So we've run a number of economic workshops now that just help whānau to understand who is eligible for support payments and what kind of income support there is for whānau, yeah, as well. So I guess that's been the main things for us, for helping our whānau with the plans, and it's helped us to shape the kind of advice and information, and also shape our services for them as well. Happy to take questions or leave it until after.
Kia ora. So clearly and predictably, people are asking, can they get a copy of this? Can they access it? You've got a whānau plan document and you've got whānau information stuff. My understanding is you're keen to share that, and we'll make sure that it comes up as part of this stuff, and there'll be some links to it as we go. Beautiful. Ngā mihi, kia ora. Oh, and by the way, one of the things I really notice is that, yes, some whānau will have some problems with this or with that. There'll be some challenges. Let's be non-judgmental about that. Let's accept that there's going to be challenges in this, and our job is to reach out and support whānau. So thank you for that.
And also, whānau have some pretty amazing solutions for their own challenges as well. So it's not like resisting the urge to jump right in and try and save them, but working through with them what their own solutions are and supporting them with their own solutions is another big one.
Beautiful, thank you. Right, ka huri ki a koe, Maia Melbourne-Wilcox. I'm going to get to the Māori women doctors who are joining us tonight. I was reflecting today that we're sort of 2 years since we started this urutā journey. It's been continuous, we've never stopped. We're here tonight. Ka mihi ki a koe, Maia, kai a koe.
Nei rā te mihi ki a koutou, kua kei te mātakitaki mai I tēnei webinar I te pōnei, ko Maia Melbourne-Wilcox a hau e urio no tūhoi no Ruatoki. And I think I get the pleasure of going after Tina, so thank you for your lead-in, Tina, providing that really important kōrero about the whānau, how it is a really stressful time, and helping our whānau any way we can to try and prepare just so that they can makes it much easier when that dust storm settles. And I think part of this, and it's kind of almost a little segue in from what you were talking about, which is I've been asked to have a kōrero just really briefly around some of the entitlements for whānau when they are in terms of just in terms of some of those supports that are available financially and how they can prepare from that part, which is a really important part of preparing your whānau. So if I'm going to share screen as well, and aroha mai, I do have a slideshow because we all know how complex some of this stuff is, and the wording's really particular when you're wanting to have awhi. And I think that, so this is mainly thinking about what are the whānau supports that are available for whānau who are having to isolate when they find themselves in a position where they're not allowed to leave their home. And certainly our doctors from Auckland who have had the big, major share of the surge and the peak, at least, and those people who are looking after Māori whānau, more than 70% of our whānau are needing support of some way, shape or form when they find themselves in this situation. And I think, and if there's anything that can help make those first few hours, days a little bit easier, having an understanding beforehand when we're not needing it might, we're hoping that that's why we're talking about this kaupapa today. My daughter looked at my slide deck and was like, "Whā mum, that's kind of like Google Classroom slides, except for really, really old-fashioned. So bear with me, aroha mai." And I think there's the really important part is around planning and thinking about the implications for our whānau if you aren't able to work and if you do have to stay home. And is there anything that we can do now ahead of time to make sure we're as good as we can possibly be? And anything that might make it easier, and then what are we going to be entitled to if we do have to isolate? So I just all of the usual things are there in the community and in the background now. So there are lots of organisations, iwi Māori organisations who are out there doing the mahi. They're delivering kai packs, they are delivering hygiene packs, and they're helping to support whānau to prepare. So know who the providers are in your area. There is some some things on some of the websites, and I've got a couple of websites on here that which will take you to links and where you can find those and find the different benefits and the different links that maybe and supports that may be available to you. I'm hoping someone like Eru might be able to select those particular websites and put them in the chat as well, so they're there for whānau. Certainly happy to make this slide deck available. So if there are places that, so before you have to, if you are found that you have to isolate, we can contact these different community and iwi organisations. If you can self-refer if you already know the ones in your area. If you've had a kaipak from them before, if you know their phone number, you can self-refer, or you can apply online through the usual. Oh, aroha mai. Turn my phone off. Or you can apply online if you through the work and income as well. So they have all of them available. It's really simple just to apply for communities of support. If we can go, you can also call the welfare number. All you really need is your name, your phone number and address, and then you choose which one, then it's a drop-down menu to choose who you want to look after you and your whānau. There are also, for those who have to isolate at home, there are some emergency one-off payments that are available just for essential costs and for emergency costs that you need to pay for to help your whānau in that setting. You don't have to receive a benefit, and it can be, so if you're working hard with your whānau normally or your hours have been dropped recently, you can be entitled to this as well. It is income tested and asset tested. There's the specifics in terms of, I'll just leave that up for a couple of moments, but won't necessarily talk to it. The urgent costs are really just around, and it's a drop down, and it's only for the time that you're isolating. You're allowed to estimate how long you're going to isolate for, so you need to also think about if it doesn't behave and if it's going to be that you have to look after tamariki for more than 7 days, you need to factor that in when you're applying for this. It's just a best guess scenario, they know that's not 100%. This one here is applying through WINS and MSD. You can select down and put all of the costs that it will cost you to isolate, and you just put in an amount for each of them. Again, that's via the welfare line if you need additional support, or it's also online, which is just drop-down menus as long as you've got access to internet and things like that. You don't need a lot for that. They do want you basically to have, if you know your MSD number, if you have one, it's on your community services card, it's on your Super Gold card, and it's on your study link paperwork. Or if you don't, if you haven't needed to be on MSD before, there are also requirements and just your normal in terms of birth certificate and or the photo ID that they usually require. So really important to think about, they ask you to estimate how long you're going to have to isolate for. So think about if your tamariki pass it on and you're the one that has to stay home looking after them, you're also entitled to these urgent costs help. This is a one-off application. So really important, the second you are positive and that you have to be home, you can apply for this. There are also entitlements that are around, all got big long names, they all mean slightly different things. This one here is the leave support scheme. This is one that we can't apply for ourselves if we have to isolate, but if our employer, if it's this one here, our employer has to apply for it on our behalf if we are to get it. And I think there has been raru with this, and certainly we've heard of whānau that's not their experience, but I think so being aware of what the entitlements are for our whānau, really important. It's actually an easy form for our employers to fill in. It doesn't take, it's not arduous, but they just have to know where to go and how to do that. This one here, they apply, and if you're a self-employed or if you're a contractor or doing that kind of mahi, you can apply for it if you have to stay home because you're positive or someone in your household is positive. You can also apply if you have to look after tamariki. So if they're positive in another household, you're sharing care of that tamaiti or tamariki, then then you can also apply for this. So that's really important to know how to do that. There are some rules, like there always are. It's 4 days, but it doesn't matter if you're rostered on or not rostered on those days. And the other thing is that if you can't work from home, those are basically the two requirements. I think we really want to let our whānau know that employers are not, it's all of the usual leave rules and legalities apply in this setting. If you have to stay home, because of them making payments like this available to your employers, they're not allowed to make you take sick leave first, and they're not allowed to make you take annual leave while we wait for. This is one of the things that has been done to try and help whānau to be able to stay home and isolate safely. Edu, I'm hoping you can capture some of those websites and help me out with that kind of stuff. There is another payment that is available from employers as well. And this one here is probably less of a thing now than it used to be. This was for people to isolate at home while they await their tests. With RATs coming on board, this is less of a thing, but just to let people know that if you are told that you have to get a PCR COVID test, it does sometimes happen. There will still be some delays. And this is the entitlement that your employer can pay for, which means they can carry on paying you while you have to isolate at home for those results. And I think basically just the other thing I really wanted to let whānau know is that there should be no cost for your care related to being COVID-19 positive. So there is no fees for you to get tested for COVID-19, to be having a checkup with your GP, whether that's with your test or not. There's no fee for the vaccination or boosters. You can actually apply for transport costs through some of those payments to get the vaccination and get transport to there. The phone call, once you and your whānau are positive, if it's COVID-related health checks from Healthline, Kowai, ahurane, ngā mea katoa, they should all be free and there's no cost to you as the person who's getting that phone call. And there's also, if you do have to have a review with your GP or you do have to have a teleconsult or be seen in person, again, that should be free. And I think the thing we really need to let our whānau know is that if you are lucky enough to be able to get an ambulance call and you need it, there is no cost to whānau, because we have heard of people being worried about being charged the fee, and that has been stopping people from getting help when they're worried. So I just wanted to let whānau know that basically there are no costs related to being COVID positive for your care or for any aspects of your transport. There are some payments that are available in terms of, and all of those usual support systems are there from WINS. I think the really important thing there is probably some of them are recoverable, which means they will take money back off you. They're basically giving you a loan and you have to pay it back. There are also some things called special needs grants and things like that, which can sometimes be for the same thing. Like if you need food, if you need groceries, if you need cleaning stuff so that you can make sure you can, all those things that Tina talked about in her whānau plan, if you need to be able to access them, they should be there for you. And if you apply for one of those special needs grants or COVID related grants, that means you don't have to pay it back. So always ask, is there a grant for this, or is there something that I need to be saying that means you don't have to pay it back? Koina.
Kia ora, kia ora. Thanks, Maia. So yeah, there was some good information in that one. Your enthusiasm, I'll get you to stop sharing your screen now, but your enthusiasm for the support that MSD can provide, I just want to temper it just a little bit, gently.
Yeah, no.
Without swearing, I'll just say it, all right, is that actually we know that sometimes MSD channels for Manaaki support have been running late. So in Auckland, we had, we had tens of thousands and stuff. And so the support was running 24, at one time, 48 hours late. So far, no, yes, reach out and try and access that. It might not happen the same day, which is a bit of a worry. But as you said, we know that about 70, 80% of whānau who are going through that channel are reaching and getting support that they want, that's a good number. We've still got to worry about the other 20%. Let me turn to you.
Can I say one thing while you turn to Papaarangi? can I say that my enthusiasm is not so much for MSD, but my enthusiasm is for whānau to know what their entitlements are and to karawhiua, Maia, challenge and get in early because there's going to be a delay. Ka pai.
Yeah, good, beautiful. You're in charge of questions and you've got a question there.
Should whānau buy rats?
Over to you, Maia.
Ka pai. Well, look, I think there are, and look, I've got lots of people on here who are going to be able to tautoko me when I say something. I never let the truth get in the way of a good story. But I think in terms of, there are lots of ways, if you are symptomatic, you should be able to access a rat test that is funded. And it should be 5. If the second one of your whānau has a positive test, you can go down, and I'm saying this because I have the luxury of living in Auckland, but where you have lots of resources around you. So this is going to look slightly different around the motu. But if you test positive, you're entitled to get a number of tests for you and all of the whānau members, so you get more packs of rats tests if somebody tests positive, or if you've got more people in your whānau, to make sure you're adequately tested. So in terms of, I'm saying
no, don't buy them, whānau. And I can
the ones you're entitled to.
Tina, you want to add to this? Before I turn to Jade, we're going to Jade in about 33 seconds. But Tina, should we be buying rat tests?
No, I don't think you should be buying rats tests. I mean, we personally provide rats tests to we do assisted testing in our community. We've insisted and pushed and lobbied very strongly to get good access to them. And so I personally, once it starts going down that pathway, then you wind up with the privilege getting in the way of the access as well. All of us at all different levels, community providers, iwi leaders, everybody should be fighting for equitable free access for rats tests for their communities.
All right, agree, hard agree. That's our manifesto. Kia ora whānau, there's 100 of you have joined us tonight. The third speaker is Dr. Jade Tamatea. She's working down in Waikato. She's been part of Uruta for 2 years as well. Ka huri kia koe.
Tēnā koe. Nei ranga mihi kia koutou e te whānau, ko te mea tau tahi ki mihi kia koe e te tangane Jace, mō kupu e whakate wharatea te pōnei. Ko waiau, ko Jade Tamatea tuku ingoa, he uri tēnei no Ngāti Maniopoto, no te aetanga mahaki hoki, e tipu aki au i Wainganui e te rohi pōtai, e raro i te maro o Pirongi a Maunga. Nei rana mihi. So kia ora, I've been given the space to talk about whānau plan from a slightly different perspective, in that approximately 48 hours ago, I got out of isolation myself after almost 3 weeks of our whare being in isolation as the ngangara made its way through each and every one of us. And I kind of want to talk about whānau plans at a very personal level of what it meant to our whānau utilising them. And so those of you who know me will know we had a plan. Oh boy, did we have a plan. It was on multiple documents. If I had my way, it would have been laminated and up on the wall. Everyone had a plan. All of my other whānau have plans because I've told them to have plans. So making plans are really important in our whare. And I work in this space. Since Delta outbreak, I've been working, assisting whānau to support them to isolate and take care and make plans for themselves. So I think plans are really awesome. And yet, when COVID hit our whare, we all lost the plot. We had no idea what we were going to do. We all freaked out. It was all a big raru, and how on earth were we going to get through this hara today? And the very first thing we were able to do was to dust off the plan and pull it out. And it really did add some toe to our whare, just to say, this is okay, guys, we've got this. We have a plan. Jade made you write down your plan, and we can do it. So that's probably my key message to get out, that actually at a really personal level, however good you think you know the system, however many hookups you think you've got, until it's written on a piece of paper, when it's all falling to pieces, it's really hard to know what to do next. The other thing I would chuck in with that, as I've pulled myself back into mahi, is we're finding more and more now when we talk to whānau, we're coming across whānau who have got their plans. And when we ring them up, they go, no, we're all good. We got our plan. We've got sis bringing the kai around. Everything's already sorted. And the tau that you feel from those whānau is really reassuring as well. And that as the country moves into a space of self-management, here is a whānau that we can be confident they have got what they need to be able to self-manage because they got themselves ready for it. And I think that's the powerful message of the plan. So I just wanted to kind of kick off with those key messages. I also want to tautoko what Tina said about our whānau have their own solutions, and they are notoriously 10 times better than what this academic thinks you can come up with as a plan for their whare. And if you take the time to get in and make your plan, you can work through those. You can test your thinking, you can experiment with it, and you can work out how it's going to work for your whare. And you can do that when it's calm and you're able to think about it. So those are my key messages about why I think plans work and how they can help. I've kind of listed, I think there's, I think it's 6 things that I think it's worth really thinking about in your own whānau plan and how you're going to manage it. The first one is kai. We don't get very far without kai, and it's one of the first things we get into trouble with in the house when we can't get some. So thinking now about how you might get kai. So that might be about different ways you can get it in. It might be about preparing it. We stocked up the freezer, so we knew that we could get ourselves through what was then 14 days if we needed to. We were thinking about what kind of kai we would want when we were sick. So we stocked up the freezer with all the stuff we thought we wanted, and then we all had ice blocks and soup, because that was what we wanted when we were sick and needed to be looked after. So kai is really critical. Fluid is really critical because people are getting really dehydrated, very thirsty, lots of puku upset. So stuff that can get fluid into you is really cool. Number 2 is medicines, and there's 2 sides of this. So thinking about your normal medicines, what you need, making sure you've got enough for the whare to get through, but also the medicines you're going to need when you're sick. My kids always say it sucks being the child of a doctor because all they get in our house is fluid and paracetamol, but I'm a big stickler that those are good medicines. And so fluid, and then if you're lucky, a bit of paracetamol. So I'd have heaps of those 2 in the whare, but whatever it is that is comfort medicine for your whare, making sure that you've got that. If it's the Vicks Vapor Rub, the lozenges, whatever it is that's your go-to, make sure you've got those ready. It's already been talked about today, but yeah, making sure you've thought about mahi. So that was in our plan. What is the plan for mahi when we're in isolation? I have mum's phone numbers, work phone numbers in my phone. She has mine. Etu has everybody's because he's actually the one that's probably going to do the mahi. But we needed to know if I was sick, someone else was going to have to call my boss. Someone else was going to have to track down Papaarangi and let her know that I wouldn't be rocking in. So we needed to have each other's plans for mahi as well. We needed to think about who's the boss that we needed to let know, who's going to get the letter to let work know if we had that kind of employer. We needed to have thought that through. The last one is having a COVID kare. And I was reflecting when Tina was saying she's so right about the strengths of her community there. As an urban Māori living in the city away from home, my networks are different, my loops are different, and so I've got different strengths to support around me. So thinking about who your COVID kare are, my biggest advice, and I learned this from my cousin who got COVID or became a case just after a tangi for the whānau, and all of her COVID kares were all in the tangi as well. So they all got taken out at once and needed to be in isolation. So you need to think of people that are, who's your kare, who's your backup kare, and who's your backup kare, preferably from different circles, so that you actually know that someone will not be in isolation when we need things to support your whare. And then, like I've said to whānau, it's kind of like your birth plan. You put it all down, you say what you want, and then you realize you might have to chuck it out on the day, depending on what actually happens. And so you've got to be willing to have some flexibility in it. And that was really hard for me because I'm quite rigid and I like things to follow their plan. But you've got to be able to be flexible. And so for us, it was about working out what was our key priority. what were the two key things that mattered to us over isolation. And one was that, trying to keep some normality going, and the other was mum. So we were a multi-generational whānau. We knew who our vulnerable person was in the whare. We knew how that was what everything needed to focus around, keeping her safe. And so that no matter what we changed, no matter what order we got sick, that was always our focus, and we could adjust our plan according to that. I do want to make the shout out to sticking to your plan though. So it's really hard when you've got babies and kaumātua and trying to get them to get through isolation when they're not allowed to go and see each other and they're not allowed to awhi, and that's really hard for them. We thought the very first week, we thought we'd got through isolation and only one person had got it. And my youngest needed to go and hang out with his nanny because he was day 10 and he thought he was done. And then later that day, he got his positive test. And that's life, and we managed it and we adjusted our plan accordingly. But just, that need to, when you've got your plan, to just stick to it till the end. So my biggest advice is make your plan now, spend some time doing it now when things are easy and they're calm. But also part of the plan is getting yourself ready now for isolation, getting yourself ready now for being COVID positive. So vaccinations, obviously, boosters awesome, but also think about what are your own health boosters? What do you do to keep yourself well? Make sure you're getting your sleep, make sure you're eating well, exercising, good balance, things that are going to make you resilient if it gets into your house. And think about your wairua boosters. How do you boost that up to keep yourself ready and whānau before this comes and unsettles your house? So whether that's getting home, whether that's getting out into ngangara, whatever it is for you, just making sure you're as boosted as you can be for this infection. And my last plug is to all the mums out there. It seems to me that all of us have been getting it last in the whare and getting sicker than anyone else with it. And then when I'm ringing households too, it's our mums that seems to be the ones trying to hold it all together, keep the house functioning, keep the plan running, and trying to manage being sick as well. So just a shout out to all of the mums to look after themselves and be well and be sick if you're sick. And try to do what you need to do to get better. So that's my story around how to use a health whānau plan if COVID gets into your whare.
Kia ora, Jade. We haven't stopped laughing. We really enjoyed the introduction to it, which was, we did a lot of planning and then all right, nice. But it helped you. It got you there in the end. Beautiful. Hey, listen, this is Q&A. So people are typing questions in to the Q&A. And I'm going to hand it over now to the question meister, who's going to manage us through this. So if you've got questions, whānau, type them in because we're going to do our best. Last webinar, we got 132 questions answered. So we're ready. We're going to type as fast as we can. If you've got questions, we're going to do our best.
Kia ora. Jade, there's a few questions that have got your name starting, but they really are about iwi support. And so I was wondering if all our speakers can talk from their experience about different iwi support that's available. But someone's asking, Michelle's asking, what does having COVID feel like? And you mightn't be the only one that's had COVID who's in the team tonight, but maybe you'd like to, from your whānau perspective, what did people say it felt like?
Yeah, I think my first answer would be is that it's different for everyone. So even if I'm just in my whare, everyone in our whare had a slightly different experience of what it was to have COVID. It's recognizable. It's like any other respiratory infection or cold or flu that you might find that you get. So for most of us, it was a very sore throat, headache, fever, cough. I've still got a cough and it's still happening even now, a week on. But there's a couple of things that were quite different about it as well. One was just the extent of it. It really did take the wind out of my sails. It really was exhausting and it really needed to rest. And it hung around for more days. So usually you get a cold or flu. A couple of days later, you're feeling okay and you're all back. Whereas, 4 or 5 days, most of us were still noticing that we were sick. We hadn't just quite bounced back as quick as usual. It didn't happen in our whare, but I know lots of whare were having issues with tamu puku stuff. So vomiting, diarrhea, and just really, really thirsty. So that was our experience.
Kia ora. Tina had some stuff on water supply for rural areas. I think that should be highlighted. Did you want to raise that? I know it wasn't in relation to a question, but it seemed like quite an important issue.
Yeah, it was just something that Jade made me think of when she was talking about fluids. Yeah, fluids are so important, but also, especially for all of the sanitizing you need to do in your house and the, wiping surfaces down and, water is so fundamentally important for your COVID recovery and for rurally isolated townships that aren't on town supply. It's good to think about, have a water plan. Have a water plan, which might be, so for us, we know which households here have a water pump and they know where the water hole is, where they can fill some up. So we've got some arrangements where some people can at least do a partial tank fill, because now we're getting to the end of summer. There are some households whose tanks are running dry, and you don't want to be trying to fight COVID when you don't have water in your household. The other thing also, though, is again, MSD can help with filling tanks as well. Generally, that's a non-recoverable grant for the first fill. So trying to get your tank refilled through MSD or have some water stashed away by the side as well.
I would agree completely. So there's something called a specials needs grant, which means you don't have to pay it back. It's for emergency and essentials, and because water is essential, particularly now more than ever, keep an eye on your tank and probably maybe don't let it go as low as you otherwise would. And maybe be proactive just in case you get it in another couple of weeks when there's been no rain. So planning ahead and having some extra stores on hand as well.
Yeah, now's a good time actually. If you could get like a half a tank full through a special needs grant, now's a good time. That'll generally see you through to winter.
And Tina, I did happen to notice that your eyeballs were rolling somewhere back in your head when it was mentioned about ambulances being free. So I just want to
my famous poker
have a
face
discussion about what do we do when we get into the situation of we have these entitlements and we don't seem to be getting those entitlements. How do we resolve that?
Yeah, well, I mean, I was told that I had to pay for our helicopter, and then I was told 2 seconds later that I probably can't afford it for one of our patients. So we're going through processes around that. Look, in the end for us, we just had to, and I'm not recommending this obviously, but in the end it just came down to the point where we found that the services were so caught up in trying to defend their decision making that it was actually costing us precious minutes, and we had to just make a call, and I PP'd up like nothing you've ever seen before, and drove our patient into hospital to get her into ED so that she was there. Not recommended, not ideal, but no other options available really. So I don't know that I can offer much in the way of recommendations other than just do what needs to be done. I had all of the windows down and I was driving with my head out the window with a full hazmat suit on, and but I managed to avoid catching COVID. It drove her home again as well once discharged, so managed to avoid catching COVID, but definitely not a recommended solution. And that's really what I've meant, is that there are some things going on with our health system that's just beyond fund. That's not a funding issue. That's a whole other kind of issue that needs dealing with. So
I'm going back to Casino's questions about the pathways for seeking assistance from iwi, and Yeah, is there anything that's standard, or do we each have to get in touch as part of our planning process, get in touch with the iwi or hapu support? How do we do this if we're not necessarily engaged?
I can speak a little bit to that. So our iwi is supporting our hapu to provide support to everybody in our community, whether they are registered iwi members or not. So if you are able to, go through, get in contact with you, especially if you're in an area that has low access to other options, I would still recommend trying to get in contact with the local. So that's just our case. But the other reason why I put my hand up to answer that is that there is a little bit of, there's a comment in there around some people we have come across, Kasina says some people we've come across did not think they were able to seek support. One of the things that I wanted to highlight is that there was a strong campaign of misinformation targeting people to tell them that you won't get support if you're not vaccinated. And it was a very purposeful one, and it's false. Of course, we really want to look after every single one of our hapu, everybody. We want to be able to look after everybody in our community, whether they're vaccinated or unvaccinated. But that's disinformation with a very clear agenda that needs to be cleared up. It's not just vaccinated people that get this care, it's everybody.
I wanted to speak to this too locally, and I noted that this question came from locals. So I know that our community hubs the majority of them are iwi or iwi group led. And so that has meant, that's a great thing, it's meant that our community, that the hubs are driven by people who live in and know their community, which is great. That does not mean that our hubs are only responding to iwi members. So in the same way that Tina said, this is about good manaaki, this is about looking after people in our regions. And so if you are in area where you're mata waka and that's not your iwi base, reaching out to the local provider will still mean that you get support. In addition to that, I know throughout the motu there are iwi who are doing virtual support or other ways of helping from wherever they are to their iwi members who are in other parts of the motu. So I think the take-home message is that wherever you are, there will be people whose job it is right now to support you if you need support, and reaching out to people will mean that you'll be able to get that.
And I think, like Tina and Jade have mentioned, there are lots of iwi who are covering rohe and who feel the responsibility to look after all Māori, and indeed some of them all communities as well. Lots of them will look after you if you're not Māori as well. So I think knowing that, but you may also be able to reach back to your iwi if you are, not staying in your home kāinga area. They are offering virtual support and support from a distance. So I think that that's really important. Reach out to those providers. You can look at that drop-down menu online to see who's in your rohe, and some of them will be iwi, some of them will be Māori-based organisations, and some of them will be women's groups, and some of them are church groups. It's just all reaching out in different ways. And so finding out about that beforehand is really helpful.
Okay, we've got about 3 minutes left. If you want a question answered, you've got to type it in right now. We'll do our best.
There's a question really around looking after children and babies that experience diarrhea and dehydration. And I suppose it's the difference between a plan and actually where you get good information from when you need support, because so I don't know whether your plan has got links to information for if you get a cough, what do you do about a cough? If you get diarrhea, what do you do about diarrhea? Or whether or not when you faced with that situation, you go looking for support. So is your plan that extensive, or do you think that we should have ready access to those sorts of information? Thinking of all the GPs that might be able to help here, as well as Tina, your plan was pretty extensive.
Yeah, our information booklet has that, not so much in the plan, but in our information booklet, the guide, does have some information for looking after tamariki that includes making sure that they have access to that. And also there are some really good resources through the Health Navigator website as well around looking after tamariki, looking after children, and particularly, yeah, stopping the risk of dehydration with them. So I'd direct people there. And I just saw that there's a question in there from Lovey around the whānau plans, around the length of them. That one's long because I'm in a small community where we can work with our people to go through it. So we recommend that they go through it because it helps to build the relationship with them, and we can respond and give them the links that they require. I know not every community can do that, especially large ones. So you might want to adapt it and make it a little bit shorter just for the online versions if you're not able to have the kaimanaki do it with them.
And just to jump in around the dehydration with our tamariki, certainly if you've got any, yes, you can make plans. If you've got any questions or concerns, there should be people who you can contact as well for urgent advice, starting from people like your regular GP, starting from Healthline, but also the person who's looking after you. If you've got a young tamariki or if they're deteriorating, making sure you're being really proactive, or you're just like, they're okay at the moment, they're still drinking, but they're doing lots of vomiting and I'm a bit worried. Again, there are those online resources, but if you need help, and you've got any concerns, reaching out to your usual people and the team that's looking after you medically if you have a team, and if you don't, reaching out to those normal numbers. And we're certainly advocating that if you need to, there's the 111 number as well. Easier said than done in some locations, but I think it's for lots of people being able to make those phone calls early. You obviously know your tamariki well, so if they are doing lots of vomiting, just trying to get the fluids on, and if you're not winning, reach out early and ask for advice. And if you need to have baby reviewed, get baby reviewed.
Kia ora, thank you. Look, we've run out of time. Was there anything you wanted to finish with in terms of the questions that are coming in? We're still trying to type answers in.
And just to let you know, we've got other webinars for particular topics like kura. So I see some questions on kura, and we'll be able to pick up some of these particular questions then. So hopefully people can type really fast and get the answers to the unanswered questions before we close. Otherwise, let us know if you need more information and more discussion, and we're happy to help.
So let's just notice we've got a webinar starting at 7:15, and that's really aimed at marae and hapu and iwi. We got 2 webinars on Wednesday night. One's for kura, and the other one is for Māori providers. So yeah, we've got some conversations going this week. Eduardo's typed in there and he said this stuff's going to be available on the Urutā website. So let's thank Urutā for the work that you're doing to support us. Let's thank Wero here, good work, and Ngā Pai o Te Māramatanga. So the sponsors, the organisations that have been able to support us to get to this place, I want to thank them. I want to thank the people on the screen, Tina and Jade and Maia. Thank you for being with us and leading this conversation and sharing. I also want to thank Sue and Anthony and Jason and Rachel. You've been typing some answers, really appreciate it. So, ka hoki kia koe, Jason, maho tēnei whakakapi, ka mutu tērā. We've got a couple of videos and then we're going to have a quick ad break. You can refresh and then you can, if you've registered, you can come to the next webinar at 7:15.
Ka pai. O tēnā tātou ko tai mai ki tēnei wahanga whakamutingo o tēnei hui e tikana i te wai tōi mai te māramatanga te whakaaro nui no roto te wāhingaro kia hoki e rā whakaaro ki āia tia ki ngā maunga tapu o tupo te rangi o tawhito te rangi. Nā runga no i tērā hikitia te rongo mai whiti o tēnei hui tuku ake ea, tuku ake o i ko rangi nui ki runga ko papatū wānu ku kira. Turuturu whakamau wā kia tīna. Haumi e, hui e.
Tai ki e.
Tēnā tātou.
tamanui te rā e ki runga i a whaira wae Heke mai ko te marangai Waipuke tia Ngā tiriti o te motu E te tangata e ki Ka whiti ana tamanui te rā e ki Maranga kia mau kia ita He runui, he ruroa Naru wai moko te runei ha Kia hakarongo te ao katoa Wa he katoa te pā Tirohia ngā whenua Tirohia ngā moana Tirohia ngā tangata Wariro atu rā e ki Ka whiti ana tamaru i te rā e ki Ki runga i a whaira wā Heke mai ko te marangai Waipuke tia Ngā tiriti o te motu E te tangata wā e ki Ka whiti ana tamanui te rā e ki Paranga kia mau kia ita He au nui, he au roa Nā tangaroa te au nei ha Kia are te ao katoa Kua he katoa te wā Me hoki haka murira Ki ngā kupu o rehera Toi tū te kupu me te mana Toi tū te whenua Daram 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 bum bum
But wait, there's more. We've got one more video coming up. Stay tuned, people. Kia ora tātou. Thank you for joining our webinar on Omicron tonight.
And we just wanted people to be able to ask questions and have answer their worries and then go away and think.
You know, for better or worse, we are still in a really good position compared to some other countries who've experienced these big surges.
We've got to protect our workforce, probably like all Māori providers. The issue I have is trying to stop our kaimahi from trying to work 24/7.
So COVID's not only an infectious disease, it is a mental illness pandemic as well.
It's a very normal human neurological reaction to become hypervigilant, or in other words, on edge, when faced with uncertainty and change.
Actually, it's less about infectious control and it's more about saving Māori lives.
And kia kaha tātou, we can do it because we you know, Manaki's in our bones and we can look after each other, and I think that's where it's at.